Chapter 28, Reproductive System, Screencast 4. We are now moving on to the male reproductive system, and the first structure that we'll actually talk about are the primary reproductive organs, which are the testes. The accessory reproductive organs are ducts and tubules that are leading from the testes to the penis, male accessory glands, and the penis itself. The first structure we'll address is the scrotum, and the scrotum is a skin-covered sac between the thighs, and it actually houses the testes. It primarily provides a cooler environment, and this cooler environment is absolutely necessary for the development of sperm and maturation. The scrotum wall, this is the external layer of skin. There's a thin layer of superficial fascia internal to the skin, also a layer of smooth muscle, the dartos muscle, which is internal to fascia. There is the spermatocord. This is a multi-layered structure traveling from abdomen to testis. And keep in mind, in this structure, this is where the blood vessels and nerves supplying the testes are. It originates within the inguinal canal. It is a tube-like passageway through the inferior abdominal wall, and the spermatic cord wall consists of 3 layers. Now, one thing to keep in mind about the scrotum is that it responds to temperature changes. When temperature is elevated, there is relaxation of the dartos muscle. The testes actually move inferiorly away from the body, and this actually cools the testes. The cremaster muscle relaxes to allow testes to move inferiorly. With decreased temperature, the contraction of the dartos and cremaster muscles, the testes and scrotum are actually pulled closer to the body, and this actually helps heat conservation. Now, the testes are relatively small organs that are housed within the scrotum. Their role is to produce sperm and androgens. They are covered anteriorly and laterally by a serous membrane. There is a tunica albuginea, and this is something that you will be asked to identify on the lab quiz. And the tunica albuginea is a thick, fibrous capsule that is covering the testis. It is deep to the visceral layer of the tunica vaginalis. There is the mediastinum testis. This is a thickening of the tunica albuginea, which projects into the interior testes. We will see blood vessels, ducts, lymph vessels, nerves enter or leave through here. Now, there are septa. These are these internal projections of the tunica albuginea, and it actually subdivides the internal space within the testes into 250 lobules, approximately. Now, the seminiferous tubules, these are very convoluted and elongated, and there are up to 4 per lobule. Now, there are non-dividing support cells. These are known as sustentacular cells. Their role is to nourish developing sperm, release the hormone inhibin when sperm count is high, and inhibits follicle-stimulating hormone secretion and regulates sperm production. Now, also contains dividing germ cells, which are continuously producing sperm. There is a blood-testis barrier. This actually prevents developing sperm from material within the blood. Primarily, it's protecting the sperm from the body's white blood cells. Now, there is an interstitial space. This is the space surrounding the seminiferous tubules. And here we have the interstitial cells. Now, the interstitial cells were formerly known as the cells of Leydig, Leydig. And that's important because what's happening here, these interstitial cells, they're going to be stimulated by luteinizing hormone to produce androgens, and primarily that is going to be testosterone. And this will be released from interstitial cells, and small amounts are actually secreted by the adrenal cortex, but not a lot. Now, here we're looking at the hormonal regulation of spermatogenesis and the production of androgens. First, as usual, we have gonadotropin-releasing hormone that is secreted by the hypothalamus, and that will stimulate the anterior pituitary to secrete follicle-stimulating hormone and luteinizing hormone. Now, remember, we're going to use cells of Leydig and luteinizing hormone stimulating the interstitial cells, or cells of Leydig to actually secrete testosterone. Follicle stimulating hormone that actually stimulates the sustenacular cells to secrete androgen binding protein, and this actually keeps testosterone levels high in the testes, and also we're looking at stimulating the production of sperm. Testosterone stimulates spermatogenesis, but it also inhibits gonadotropin releasing hormone secretion and will reduce the anterior pituitary sensitivity to gonadotropin releasing hormone. Rising sperm count levels cause the sustenacular cells to secrete inhibin, and this further inhibits the secretion of follicle-stimulating hormone. Testosterone stimulates libido and development of secondary sex characteristics. Now, the next topic we're going to address is the process of spermatogenesis. And remember, this takes place within the testes. Spermatogenesis is the process of sperm development. It occurs within the seminiferous tubules. It begins during puberty and is due to the rise of follicle-stimulating hormone and luteinizing hormone. Now, spermatogonia, these are primordial germ cells from which all sperm develop. They are diploid cells, and they are found near the base of the seminiferous tubule. They are surrounded by cytoplasm of sustenacular cells, and these spermatogonia will actually divide by mitosis into new spermatogonium and primary spermatocytes. Here we can actually see the process of spermatogenesis and spermiogenesis, and we're starting off with this spermatogonium, and notice it's diploid. Okay? Now keep in mind that the spermatogonium will undergo mitosis. Now note, we have not talked about anything happening prior to birth, so this is all happening with the onset of puberty. Now remember, the spermatogonium are diploid. They have 46 chromosomes, and they are going to divide by mitosis. This will maintain a constant population of spermatogonium and primary spermatocytes. Now, the primary spermatocyte will undergo meiosis 1, and now it will actually divide into 2 haploid secondary spermatocytes. The secondary spermatocytes will actually undergo meiosis 2 and end up with 4 haploid spermatids. And these spermatids eventually will develop into sperm. Now, on this other panel, we can actually see the developing of the sperm. And one of the things we want to look at is the development of the acrosome cap. And we can actually see the nucleus of the spermatid, and then the development of the flagellum. Keep in mind that sperm are the only flagellated cells found in humans. Now we can see greater development of the acrosome cap. We can actually see more clearly the nucleus of the spermatid, and the flagella are continuing to develop. Now we see real development here with the acrosome cap, the nucleus. We now actually see the mitochondria. There's excess cytoplasm, and the flagellum. Now, the acrosome cap, what's important to keep in mind here is that actually has digestive enzymes. And those digestive enzymes are really important so that once they get to the egg, those enzymes can actually digest through the outer layer of the egg and actually fertilize it. Now, if we look at differences as far as female versus male gametogenesis, one thing to keep in mind: in females, there is a single viable secondary oocyte that's produced, whereas males will actually produce 4 sperm. Female oocytes are arrested in meiosis prior to birth. Male spermatogonia do not start spermatogenesis until puberty. Females are only capable of reproducing up to menopause. Male spermatocytes are produced throughout the male's adult life, resulting in no real limitation of reproductive lifespan in males. Now, there are some issues associated with paternal age. Males over 45 years of age, they are 4 times more likely to pass on genetic mutations than men in their 20s. This risk increases with age. Examples would be bipolar disorder, schizophrenia, autism, depression, attention deficit hyperactivity disorder. Now, keep in mind maternal age is not correlated with an increase in these disorders. Now, keep in mind age of both sexes do carry risk of developmental problems. So keep in mind it's not uncommon that a woman becoming pregnant in her later years will need to undergo amniocentesis, and this is a process or a procedure in which they're actually looking at the viability of the developing embryo and fetus. Now, the last couple of slides will be focusing on sexually transmitted infections, and these are infectious diseases that are transmitted via sexual contact. Most STI symptoms transmitted because symptoms go unnoticed. Condoms are the only type of contraception which actually help to prevent the spread of STIs, but keep in mind they are not 100% effective. Now, the other thing also to remember is STIs are a leading cause of pelvic inflammatory disease in women, and this can actually result in blockage of the uterine tubes and also infertility. Chlamydia, this is the most frequently reported STI in the United States, and it is due to a bacterium. Most people present with asymptomatic symptoms. Symptoms may include vaginal discharge, painful urination, and back pain. And as this is a bacterial infection, it is treated with antibiotics. Genital herpes, this is actually caused by the herpes simplex virus. This results in cyclic outbreaks of blister formation in genital and anal regions. At the time, there is no cure for genital herpes, but antiviral medications do lessen severity and the length of outbreaks. Gonorrhea, and currently there is a strain of gonorrhea that is actually resistant to antibiotics, and that does create a problem. This is another bacterial infection. It is spread by sexual contact or from mother to baby during delivery. As it is a bacterial infection, it also can be treated with antibiotics, but as noted previously, the current strain of gonorrhea that is most prevalent is actually resistant to antibiotics currently used. Syphilis, this is also a bacterial infection, and it is spread sexually via contact with syphilitic sore, canker, or in utero. Now, this is treatment with antibiotics, and there are stages known as tertiary syphilis, and in tertiary syphilis, we see significant central nervous system issues and overall a lot of problems that are tied into that.